Hello, everybody. My name is Ben Calderwood. Happy to welcome you back to the World Health Network broadcast. We're going to do a quick news update today, discuss the status of our current COVID surge as summer moves into fall. Dr. Joe Eastman is with us, as well as Dr. Eric Feigl. As always, I'd like to ask you to perhaps like this broadcast and subscribe to the channel. That will help the World Health Network out. Anyway, let's get into it. Dr. Joe Eastman, thanks for joining us today. Let's go ahead and tell us a little bit about the status of the current surge and what your data shows.
Yes, first of all, the status of the data has been rather intermittent. When we do forecast models, we need to use wastewater-derived new daily infections, but also have the variant proportions updated at a rather frequent level. A lot of this has been in flux. The wastewater data itself has slowed to a trickle. We only get updates sporadically, whereas it used to be a continuously updated system. The other part of that, the CDC variant proportions, were not posted since June 21st, and that's when I did my last forecast. Since the forecast, they started going to monthly updates starting this August. So they've backfilled everything at 1 month resolution instead of a 2 week temporal resolution. So let me show you an example of what their new product looks like and some other promising work that we're doing at the WHN. There you go. What you're looking at, first of all, is the current status. It might be a little difficult to see, but this dark purple line here is the new daily infections derived from the wastewater data going back to the first of the year for 2025. What you see in the green line, lighter green line, right next to it, almost juxtaposed, is my last forecast, which was conducted on June 21st of this year. And I typically do a four-month forecast. You can see by following the 2025 line here that the model is tracking very well. Our current new daily infections are roughly 850,000 a day. It's slowly rising. And you can see the data lag here right at the end of 2025 where the line kind of levels out. That's where we do preliminary estimates, and we don't validate that as actual data, but we consider it just a preliminary estimate. So that will fill in here over the course of the next 2 weeks. And if that is the case, and I suspect it will be, we're going to approach over 1 million in the MAPS forecast that I do will also align well with what has been going on in the national wastewater data. So the potential is the MAPS forecast has us peaking next week on right around 9/11 at about 1.5 million new daily infections. So going back to the CDC data down here in the lower right corner here, you see their new product. And this is, it breaks it down by variant, who's causing the surge right now. Roughly 3 months ago, XFG and NB.1.8.1 were essentially tied. In fact, it was an interesting coastal war that was going on where New York in the East Coast was dominated by XFG, while California and the West Coast trended towards NB.1.8.1. When the data went silent, I knew we had to do something. So at the WHN, we've been working on a new product where we derive our own new variant proportions data from the GISA data. And it goes through a complicated process, and we calculate the variant proportions, and then also combine those with the new daily infections that we're already calculating and are posted on our website, whn.global/data. And here's an example of our new product over here. These are the dominant variants right now, and previously dominant was the LP81. But you can see we now have more information on the different sublineages of XFG, going from XFG to XFG.2 and .3. And we also have several flavors of NB8, NB.1.8.1 that we can use. And this is a national average that we are calculating here. And you can see where we are right now. This data will fill in as we proceed past this point, and I expect it to go up even higher. All three of these now are various sublineages of XFG. What you see down here in the lighter green line is NB .1.8.1. So it's going to be a promising product because we can still update more frequently. And we will be forecasting regularly now, approximately once a week, and providing that data on the WHN website so people can plan accordingly moving forward, having a 4-month prediction so they can look at their dental visits, medical visits, et cetera, and when is probably the best time to schedule those. So with that said, I will stop there.
Thank you, Joe. I just want to repeat, you said your current estimate is showing it, you're guessing that this will peak in approximately a week. We're recording this, we're having this discussion on September 5th. So you're guessing September 11th is a likely peak for our current surge. Is that correct?
That is correct.
Okay. So with all of this data in mind, I'd like to turn now to Dr. Eric Feigl and thinking about what is currently going on at the CDC and the FDA regarding the status of vaccine approvals and what people should do, adults, parents, and children, in terms of getting boosters and what they need to consider when they look into getting vaccinated with the 2025-2026 booster. Eric.
Yeah, thanks, Ben. And thanks for that summary of the current situation, Joe. I think there's a lot of turmoil lately with the CDC and FDA and HHS in general. And with the firing CDC director, that's actually put us in a very unique situation because recently, about a week or two ago, depending on when you're watching this, the FDA approved the vaccine for the new updated formulation, 2025-2026 formulation of the COVID vaccine. But normally that isn't enough. Normally they do also an ACIP committee review and recommendation, and the CDC director signs off on it. Well, that we're not living in normal times. The ACIP committee right now is full of, RFK Jr.'s anti-vaxxers, and the meeting's been postponed, and we don't have a CDC director. We have an acting director, but no ACIP meeting. And so what happens is, like, right now, it's an approved, but there is no ACIP sign off, and that creates a situation in which certain pharmacies in certain states cannot give the vaccine, or they can give it only with a prescription. As opposed to previously, you could just walk into a CVS, give them your health insurance, and they'll just give you the COVID shot at will. But that's not how it is right now. In about half the states, and this list is always changing right now because there's new coalitions of states trying to fix this. But some states, pharmacists cannot give it, and you cannot have it without a doctor's or nurse practitioner or physician assistant's prescription. Some states you can, and it's about half and half. And other states right now, you also have problems getting it for children because children, the other thing is they did was they lifted and removed the emergency use authorization for those who are 6 months to under 5 years. So If you're under 5 years old, that's very tricky. Currently, actually, only those with Moderna can get the Moderna 6 month to 5 year one. But it's the Pfizer one, apparently you can't at the current moment. And what you have to do for children is you have to get a specific doctor's note for off-label use. So for this, pharmacies absolutely cannot do. So if you have children under 5, you definitely need a doctor's note, and you can probably only get the Moderna at the moment. If you're over 5 years old, you have in certain states you can only get the mRNA vaccine, of course, and a Novavax is available for only for those 12 and over. But again, it's such chaotic, and there's Western states like Oregon, Washington, and California that's creating a new health association, and Massachusetts is creating their own separate. Basically, the state governor has issued a decree that people should get it. It's to basically override certain restrictions with pharmacists in those states. But this has really been unprecedented because we've never had state government give these recommendations, which again, now we're in the situation of whether you live in a red state or blue state actually really matters, right? In terms of access to vaccines. And obviously, vaccines mandates were removed by, Ron DeSantis and Florida Surgeon General Joe Ladapo altogether for all vaccines. For kids going to school recently. So there's so much chaos. I think this is one of those times where you really should really talk to a doctor because you literally might need a doctor to override some of the existing stuff that there's barriers. And I need specifically, please follow, American Academy of Pediatrics, American Public Health Association, these really well, evidence scientific based organizations and not just the edicts of your state or our federal leaders, which is a very sad thing to say, of course.
Uh, Considering how chaotic these circumstances are, I want to reiterate those recommendations that you provided at the end. Speak to your doctor if you do have a doctor. If you don't, follow the recommendations of those health associations, American Academy of Pediatrics, especially if you have children. Um, any other, as we come to the close of this recording, considering how difficult it may be for certain individuals to get boosted, any other sort of general recommendations in terms of, and I would open this up both to Joe and Eric in terms of just sources to follow in the news, places to look, looking forward, what should we be paying attention to in terms of how to stay safe in our current surge?
Yeah. Well, not RFK Jr., obviously, or his new acting CDC director, who is a former George W. Bush speechwriter, has no public health or medical background whatsoever. No, I think we have to basically follow news carefully and maybe even strategically, go to neighboring states that might have more flexibility around these. Um, and I think definitely find an able, willing, doctor. Or even think if you, for example, made a appointment with a minute clinic instead of the actual pharmacy at a CVS, you would get very different treatments. One is a healthcare provider. One is just the dispensary, who is now very restricted in what they can do. I think you have to be a little creative these days and find greener pastures to get access to the healthcare that you want.
Well, I think that's going to conclude our news update for today. This is the status of vaccine availability is definitely something that we're going to try to stay on top of here on the channel. Hopefully, we'll be able to update this story in the coming weeks. I'd like to thank both Dr. Joe Eastman and Dr. Eric Feigelding for joining us on the channel today. Thank you both. As always, we are the World Health Network, global organization devoted to ending the pandemic as a global health threat and in general reckoning with additional challenges to public health that are growing in 2025 and beyond. Please check us out online at whn.global, and we hope you'll consider participating. Thank you so much. We'll see you next time.